Thank you, Mr. Speaker. Kevin Steele, who's the district attorney in Montgomery County, one of the 4 counties that I represent a portion of in southeastern Pennsylvania, noted earlier this week that there are 2,500 drug overdose deaths in Pennsylvania over the past year, 60 alone in Montgomery County. And this is what he said: "We're seeing numbers we haven't seen before. We are on pace to have the deadliest year for overdoses." Now, not all of them are heroin, but quite a good number of them are. I did not plan on coming down here to the House floor and speaking about any particular individual who I know, and I won't name names, but I will say this, and this is a bit of a surreal moment for me. Between the time that I left my office and I came to the House floor, my brother texted me to let me know that someone that he went to high school with, who he was good friends with, who played in my backyard growing up, had passed away. And I then reached out to my other friend, who let me know that it was indeed, by all accounts, heroin. And in speaking with this friend, he shared with me the names of a few other individuals from my high school that I was completely unaware of who have passed away in the past 6 months. Kids I haven't seen or heard from in 15 or 20 years, but nevertheless, it strikes very close to home for me, and I'm sure a lot of members here tonight who have had firsthand experience with the epidemic. As a member of the Bipartisan Task Force to combat the heroin epidemic, I do want to thank Mr. Ginta and his leadership. We have an opportunity this week to take constructive steps to combat the heroin and opioid epidemic that damages our communities and destroys families. And we have that opportunity by bringing a series of common-sense, bipartisan bills to the House floor for consideration. Now, it's a package of bills. I won't get into the specifics of each one. I'd rather paint with a little bit more of a broad brush here this evening and simply say that these legislative efforts to take constructive steps to get direct and immediate resources to those on the front line in this battle, our first responders, our physicians and healthcare providers, our local and municipal officials, is a tremendous step forward in the right direction. I served as a county commissioner, and I can tell you, I know the challenges that our local emergency responders and law enforcement professionals face each and every day. Indeed, last week I was in Berks County, one of the 4 counties I represent, and had a roundtable with the county commissioners there, the district attorney, the director of the emergency department at the local hospital, and also drug treatment professionals. It's very clear that we need a multilateral approach between drug treatment professionals, medical professionals, local officials, but the theme is somewhat the same. We have outdated regulations, we have insufficient resources, and we need to better align the resources that we are providing. And that's what we're going to do this week in the House. Positive, productive steps on a bipartisan basis to get those on the front lines in our communities the resources they need. And in doing so, we will better empower our local first responders, our local law enforcement, and our community health care providers. I would be remiss if I didn't also speak about the issue of prevention in the first instance. And abuse deterrent medications are critical. And our life sciences industry in my district and across this country are making tremendous strides. It is a key component in preventing addiction for many in the first instance. Let me conclude, though, with this, Mr. Speaker. As legislators, as lawmakers, we can't end this epidemic. A law, any number of laws that simply pass the House that may get signed into law are not going to end an epidemic. We understand that. And I want the American people to understand tonight that we're not saying that by passing laws we end the epidemic. But what we can do is improve collaboration and better align resources from and for the various stakeholders so that together we can turn the trajectory of this epidemic, which is on a very dangerous course, we can turn it into a declining direction, which is what we need to do. We need to turn this around. We have a tremendous opportunity here in the House this week to take very positive steps in that direction. I want to thank Mr. Ginta for his leadership on this issue. I yield back the balance of my